So what do we do if my work requests a clearance to return to work, but I don't meet the criteria for COVID testing?
So your care team will clear you clinically. We'll base it on the symptoms that you're having, the history, and also any risk factors that you may have. And ideally, we would like to have laboratory testing as well. But if you did have, some of the symptoms that are concerning, we will most likely wait till you're symptom free and release you once we have at least two negative COVID tests that are tested 24 hours apart. And in this instance, we're just taking precautions so that, we want to prevent a massive spread where it would be negligent on our part if we were to release a patient to return to work and then was later found to have COVID and then infect, an entire workforce.
Mm. Yeah, I think the hard part here is availability of fast, reliable testing, right? Because that testing is not available, you cannot be 100% sure whether the employee is safe to go back to work or not. So it's better to be overcautious. So at least a week's, 7 days of no symptoms. And then hopefully as time goes by, we can get some reliable, fast testing, and we can also, test those people laboratory wise before we can clear them to go to work. But it may have to be on a case-by-case basis at this point, basically, seeing what kind of work that employee does. And again, if it is essential work, then it may be a dialogue between the employer and us that, okay, if the employee does return to work, everybody else should still take maybe extra precautions, trying to avoid contact with that person, until things clear up more.